Everyone, I'm here once again with the new series of these health AI sessions, and we're going to start the second module, which is on the history of AI in healthcare, and we'll do a structured historical analysis of AI's relation in healthcare and public health. So we have seen a lot about health AI in the recent past. There had been a technological waves, which explains major technological changes and that influence on medicine. We have information about different eras on AI that distinguishes between rule-based, statistical, deep learning, and generative AI eras. We have some landmark studies which we want to talk about, and we want to identify the studies that shaped clinical adoption of AI. AI has evolved substantially from the time which it was conceptualized to the time which has been implemented, and we want to talk about that. And there are some governance and ethical aspects of the historical aspects of AI. We want to talk about those as well. We're not going to be able to talk about all of these in this session, but these are broadly the objectives of this module. So talking about AI, some of us may feel that AI is a very recent phenomenon, but it may come as a surprise to many of you that AI has been there for ages. The early foundations and the conceptual foundation of AI was made in 1940s to 60s. That includes Alan Turing and Turing test and that lays the foundation of machine intelligence framing. Early symbolic and logic and rule-based reasoning was founded over there, and uh, emergence of computational decision-making models was founded over there. Early computerized medical records were also founded in that year, and that laid the foundation of medical informatics. This era established the theoretical basis, but lacked computational power for practical and clinical deployment. So then we come to the era of expert systems era. Then it can be explained from a number of aspects. For example, there was a core paradigm shift, which uh, not actually shift, but there was the paradigm was rule-based systems relying on human-coded logic. The landmark systems which have been formulated in this era include the MYCIN antibiotic selection and internist one diagnostic reasoning systems, and that was characterized by knowledge engineering. It was driven by knowledge engineering, and basically it was some code which was relying on if-then logic and limited scalability and high maintenance required. It was not easy to maintain. It has some impact, but it has some limitations as well, and it demonstrated feasibility but struggled with uncertainty, rigidity, and lack of large data sets on which these models were formulated. Uh, then we come to a statistical era and the boom of electronic health records. The digitization of health record revolutionized AI enabling predictive modeling. We formulated different statistics, though again these models are very old as well, but the adoption of this model and implementation of this model and decision making uh, based on these models was substantially increased in this era that is between 2000 and 2012. There was key adoption or there was increased use of logistic regression, survival analysis, and clinical risk scoring system, and a lot of these are just of the few of the statistical techniques. Those of you who are involved in statistics, they know that there is a large list of statistical methods that have been used in this era, and the key drivers of this era were the expansion of electronic health records, growth in computational power, and enhanced methodological research and biostatistical methods, and their use for health research. In public health, there was surveillance model, early outbreak prediction, and population risk stratification. This era successfully bridged epidemiology with I would say, techniques that laid the foundation of machine learning. Then we come to an era which we call as the deep learning revolution era, triggered by the ImageNet breakthrough in 2012. Deep neural networks transform pattern recognition, profoundly impacting healthcare. Some of the initiatives In this era where ImageNet breakthrough, the deep neural network surpassed traditional models in pattern recognition, setting the stage for healthcare applications. Google Health pioneered diabetic retinopathy detection, which has been published in Nature in a paper in 2016, showcasing AI's diagnostic ability. DeepMind was founded, and it advanced acute kidney injury prediction, and that is also published in another paper in 2019, demonstrating predictive capabilities. Stanford University worked on developed checks net for pneumonia detection by chest X-ray, highlighting AI's role in medical imaging. Um, so then, as the world was progressing towards more of the use of AI, then clinical integration and regulation also got uh, it got its attention, and as AI model matured, the focus shifted towards practical deployment and establishing a robust governance network. And some of the regulatory milestones include US FDA developed AI ML-based software as a medical device framework. So basically, FDA started to regulate the provision of services through AI and ML-based software, and adaptive algorithm oversight established for dynamic AI systems. World Health Organization introduced ethics and governance for AI for health principles. The key themes over here was emphasized on emphasis was on explainability to foster trust. And there was an emphasis on bias mitigation and fairness in an AI model, and there was an emphasis on post-market surveillance for deployment of AI solution. Uh, AI was used, or at least advocated to be used in immunization coverage modeling to improve the immunization coverage, enhance disease outbreak forecasting was emphasized, and critical prediction was done in critical COVID-19 predictive analytics were done during the pandemic, which we saw also. So then the next foundation came, and the generative AI and foundation era, which is still we are seeing its impact that started from 2030, 23 from the launch of ChatGPT, and then its founding, and that advanced beyond pattern recognition to language reasoning and synthesis with the advent of large language models. So the core paradigm was large language models. AI moved from single pattern recognition to sophisticated language reasoning and synthesis, enabling more human-like interaction. Its application included clinical documentation automation, medical question answering, patient triage chatbots, and literature synthesis. The shift this shift its capacity from narrow specialized AI to general model offering broad reasoning assistance and predictive power. And in public health, policy analysis automation, real-time surveillance narratives generation, advanced decision support for health systems were some of the areas where the application of these models were considered and are still being considered. There are some challenging in this area that includes the risk of hallucinations, rigorous clinical validation, and developing robust liability frameworks are still in the process. Some of them, I mean, work is still ongoing in this area. Moving forward, so this basically summarizes, uh, like we started from rule-based core technologies to statistical methods to deep learning, and then we are in the era of generative AI. So early systems struggled due to workflow misalignment. Deep learning success was driven by scale and data availability. Current bottlenecks involve trust, regulation, and equitable access, and future focuses on AI augmented health system, not clinician. It doesn't focuses on replacement of the clinician, but it emphasizes on AI augmented clinical care support. So the key concepts from here is that so the question becomes that where are we moving forward? The evolution in healthcare highlights a significant shift from static knowledge-based systems to dynamic data-driven and adaptive models, which means that AI paradigms have moved from human coded logic to learning from vast data sets. Initially, they were static. They have moved to adaptive learning, which means the model now continuously learn and adapt, enhancing their own predictive accuracy over time. It has diagnostic to workflow automation has improved. AI's role expanded from mere diagnosis to optimizing and automating clinical workflows. And from moving from individual level clinical support, it has moved to population level intelligence, and which means that the scope has broadened to address health challenges at the population scale, and it has moved from narrow to foundational models, which is specialized AI is giving way to generalist foundation models with broad applicability. So where we are moving next, there are few areas where, I mean, um, this is a very difficult to answer this question, but a few obvious things are there where we may be moving next, and some of them are already there. For example, multi-model integrating imaging, genomics, EHR, and variable for holistic insights, real-time global disease intelligence, emphasize on advanced systems for proactive health monitoring, AI embedded primary health care, enhancing care delivery, especially in low and middle income countries, and causal insights, moving beyond correlation to understand cause and effect, and clinical decision making is an area on which work is being done. So this was just a foundational lecture focusing on the overview of this module. In the future lectures, we'll be focusing on details of some of these areas. Thank you very much for watching. See you in the next lecture.